Asal rasa sakit dada ni Uish, rasa lain macam ni. Tak ada apa-apa kot, penat sikit je ni. Jangan ambil nyawa lagi. Aku tak jaga.
Kenapa ni? Tak.
Okey je kot. Rasanya sakit dada sikit je kot sayang.
Alah, ayah kata pergi hospital ni tak nak.
Tak ada apa-apa lah. Benda biasa je. Okey je, sikit je.
Tak ingat.
Ini kenapa?
Saya sakit dada lah.
Ai nak buat apa ni? Ai tak tahu nak buat apa. Kejap. Ai tahan kereta, okey? Kereta! Tolong! Kenapa ni? Ai kenaya. Dia sakit dada. Kenapa? Tolong bawa dia pergi hospital. Boleh. Masuk dia. Boleh tak? Sini. Masuk. Cepat. Cepat.
Gila lagi aku nak sedar ni. Nak sedar? Doktor! Masuk. Doktor lagi saya dah sedar.
Apa?
Saya dah sedar.
Oh.
Dia sakit apa? Tolong lah. Tolonglah, jangan bagi dia mati.
Encik okey tak? Ya. Sabar dulu Encik. Boleh rehat dulu. Puan untuk saya untuk saya terangkan nanti.
Duduk sini dulu ya.
Okey, puan masuk. Duduk sini.
Doktor, hati saya ni mengidap penyakit apa? Dan saya nak tahu dia punya faktor, dia punya cara rawatan.
Don't worry, madam. Your husband is still in the early stage of the illness. He's still able to give treatment. He's still able to alive. Okay, about the illness, what your husband facing is he's having atherosclorosis. It's a type of heart attack. The symptom includes chest pain, difficulty to breathe, difficulty to sleep, and also difficulty to eat. Okay, the factor that leads to this illness is from here we can see that the heart of your husband is composed of many blood capillaries. As we can see, one of the capillaries of your husband has been blocked by the cholesterol, or we call it as a plaque. This is due to the daily life of your husband having, which includes consuming oily foods and also smoking. And the treatment, which includes.
The procedure is started by a small hollow tube called the catheter is inserted into the artery in the coronary arm and trapped at the affected artery. Then, a thin flexible wire from the catheter is passed through the blockage in the artery. The thin flexible wire acts as a road for the catheter to able to pass through the blockage of the artery. This catheter consists of balloons which are ready to be inflated towards the blockage of the artery wall. At the same time, the inflated balloon stretches the lumen of the artery to open, which then increase the blood flow to the heart. Both catheter and the wire are withdrawn, leaving the stent inside the coronary artery. This stent holds open the lumen of the artery by preventing the wall of the artery to collapse. The stent stays permanently as the blood vessel lining hold over the stent.
What is a stent? Stents are small expandable tubes used to treat narrowed or weakened arteries in the body. In patients with coronary artery disease, stents are used to treat narrow arteries and help to reduce symptoms such as chest pain. There are 5 types of stent available. The first is a dual therapy stents. It is the latest type of coronary stent. It combines the benefit of drug-eluting stents and bioengineered stents and is the only stents to contain a drug with the active healing technology. This healing technology reduces the blood clots, inflammation, and helps the healing process of the artery. Secondly, is the bioresorbable vascular scaffold. It is a drug-eluting stent on a dissolvable type of scaffold platform which can be absorbed by the body over time. The material used for the scaffold includes biodegradable polymeric substances, which includes polyglycolic acid, polyhydroxybutyrate, and others. Thirdly is the bioengineered stents. It is also known as the antibiotic-coated stents. This type of stents differs from dual-eluting stents because it does not contain a polymer and does not use a drug. As a result, it helps to speed up the cell lining of the artery, which promote a natural healing. Next is the drug-eluting stents. Drug-eluting stents are coated with medication that is released to help prevent the growth of scar tissue in the artery lining. Last but not least, bare metal stents are usually stainless steel and have no special coating. What are the benefits of stenting? For many people, stenting has a positive impact on quality of life. The combination of angioplasty and stenting can be a lifesaver, especially when performed right after a heart attack. The benefits include improve our blood flow to the heart and prevent further damage to our heart muscle. It can also reduce symptoms of heart disease such as chest pain and shortness of breath. In some cases, stenting create alternative for people by eliminate the choice to undergo bypass surgery. Last but not least, for those people who've been treated by angioplasty and stenting, the recovery time is much shorter.
Okay, thank you doktor. Saya dah faham dah proses dia macam mana. Nanti saya bincang dengan laki saya.
Okay, sebelum tu, proses untuk buat pembedahan tu dia kena ada surat untuk buat operation tu. So puan balik dulu bincang dengan suami puan sama ada nak teruskan pembedahan ke tak.
Okay.
Okay.
Thank you doktor.
Alright.
Sebulan dah. Degil sangat kenapa? Lepas tu makan malam-malam keluar pergi lepak kedai makan esok dia bawa tu. Ingat sihat ke? Tengok sekarang dah sakit dah. Jangan tu tersumbat dah apa dah. Okay, doktor dah terangkan dah proses tu. Proses tu selamat. You boleh hidup lepas proses tu. So you nak bedah ke tak? You kena setuju dulu. Nanti doktor datang bawa surat.
Yalah, kita dah kenal dia macam ni, mesti setuju je.
Bagus.